In a matter of weeks, the novel coronavirus has changed life as we know it. Communities across the globe are practicing something called social distancing, which basically just means not coming into close contact with other people. But humans are social creatures, so it's no wonder the question that's on everyone's mind is, how long are we going to have to live like this?
Viruses can be scattered with each particle of saliva and mucus.
Don't assume your community won't be affected. Prepare as if it will be. Don't assume you won't be infected. Prepare as if you will be.
So basically, one of the ways that you can think about an epidemic is that it needs two things. It needs infected people and it needs susceptible people. So if you think of a forest fire, the infected people would effectively be your spark. And if there are susceptible people around, or in the case of a forest fire, fuel, those sparks can start fires and basically spread the outbreak or the disease farther.
In the absence of a vaccine to stop the spread of COVID-19, we have to find other ways to slow down the spread, which is where social distancing comes in.
All of this is meant as a preventative measure to try and really extinguish the ability of that virus to move amongst the community. Because in a lot of cases, we simply can't tell if somebody is infected or if they're sick, which makes it really difficult for us to trace where this virus is and where it's going.
Health experts say social distancing is the best and quickest thing we can do to save lives by flattening the curve.
You know, we talk a lot about flattening the curve, and at this point, I think it's kind of part of the vocabulary, to the point where like my dad is talking to me about how we're going to flatten the curve, which, you know, normally he's not that interested in my work.
The curve we're talking about refers to the projected number of people who will contract COVID-19 over a period of time. There are two factors which impact the curve: when control measures like social distancing and testing are implemented, and how severe those measures are.
Even if you do the really drastic or dramatic control measures, if you do them late in an outbreak, they don't really do a lot. And so it's not just the sort of control measures that you implement, but it's also when you do it. So if you do it early, you can have a pretty dramatic effect without necessarily having as strong control measures as if you try to intervene later on in the curve. So it's really the combination of the two that really matter here.
So what will happen is that ultimately, even if we have the same number of cases between the two situations, if we broaden out the amount of time that it takes for people to get sick and for people to show up at the hospitals or to their respective clinics, ultimately we have a better chance to be able to provide treatment for those patients without again overburdening the healthcare system.
When healthcare systems become overwhelmed, people die as a result of not having access to care or testing, which is what has now happened in Italy.
Italian hospitals are at their absolute limit, with hundreds more deaths reported daily and huge challenges in caring for those infected.
From Italy tonight, the most staggering toll yet: 475 deaths in just the last 24 hours.
But there have been success stories too. Places like South Korea, Singapore, and Hong Kong have brought their outbreaks under control by implementing a combination of testing and social distancing. But even if we succeed in flattening the curve, new research suggests that we may need to keep up social distancing for months and possibly over a year. A report by researchers in the UK found that in order to avoid hundreds of thousands of deaths, social distancing measures will need to be maintained for up to 18 months, which is about the time a vaccine might be made available. Ashley's team conducted a similar study of just Ontario and found that it would need to maintain social distancing for more than 6 months in order to significantly flatten the curve and delay the epidemic peak.
It's going to be long. It's not possible at this point to say that in 6 months everything will be back to normal. It's not possible to say, you know, a year from now everything's going to be back to normal. I think we have to be psychologically prepared for the possibility that we're talking about a very long-term disruption.
But that's not to say that social distancing measures would need to stay the same over that entire period. Certain rules could be relaxed over time as the situation improves, though experts fear that if we ease up on social distancing too soon, there's a chance that the virus could experience a resurgence.
These are the timeframes we need to discuss, while also being open to say it's fluid, it's dynamic, we don't know for certain, but we, in some ways, in some senses, can actually help guide how quickly all of these things occurred, we can go back to somewhat normalcy.
That's the thing about this pandemic. There's still so much uncertainty about what will happen next. And a lot of it will depend on all of us getting used to staying indoors and FaceTiming our friends and family. This won't last forever, but for now, the consensus among health experts is that we all need to do our part.
Every step we take to prevent the spread of disease means increased happiness for all of us.
Thanks for watching. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel, where we also dig into big issues around the world in our weekly series, Global News Explains.